Autism is the only medical condition that we diagnose by behaviors that the symptoms cause and not the underlying issues. For instance, if someone's broke their arm, how do they diagnose that? What's the symptom of that? Is it a tear? Is it a frowny face? No. Those may be behaviors that the symptoms are causing. The symptoms of a broken arm are redness, swelling, pain in the area. Also, the focus tends to be on how autism affects others and not the patient themselves. So to take example, the broke arm, if your star softball player has broken their arm the night before the playoffs, no one would discuss, it wouldn't even be in the discussion of the fact that that was going to cause the baseball team to lose or how that was going to affect the baseball team. The focus would be on the patient and their bone and mending that bone. And with autism, a lot of times, sometimes it's quiet. It's quietly in there, but it's always there. Eye contact is a great example. Not making great eye contact in no way, shape, or form really, that's not really affecting the autistic person. In the social game, it is a little bit, it's affecting others. They don't think they're listening or whatever it is that people get and gain from eye contact. A lot of the repetitive behaviors, we're looking at how not having trouble communicating. We're looking at how it's affecting the other people, maybe too much. Also, it's too subjective. You're at the mercy of whoever's giving you the questionnaire. It's outdated. It's skewed very much towards males. Instead, we should test for things that can be measured. Science, medicine, right? And I think there's 3 things that could be tested in that manner. And the first one is called bottom-up processing. It's one of the 2 primary thinking styles that people use. It's my theory that all autistic people use bottom-up processing, and that NTs primarily use bottom-down processing. The symptom of the bottom-up processing is sensory overload. So we're not going to fix bottom-up processing. There's no fixing that. I'm not sure that it needs to be fixed. It's just different. But the symptom of it is the sensory overload, and that's what needs to be treated, because sensory overload is what causes the anxiety, shortened lifespan, meltdowns. The second thing that we could test for is for damage to the Broca's area. Broca's area is a part in your brain that is responsible for comprehending spoken language, and it is another thing that autists have trouble with. It's not deaf. A lot of people think they're hard of hearing. It's not that. Hear fine, can't comprehend what we're hearing a lot of times. So we could test for that. That's an easy test. The symptoms of that is if you can't hear, if you can't understand what the people around you are saying, how can you not miss things? How can you not miss social cues? How can that not lead to isolation and communication difficulties? And then the third thing that you could test for is a weak theory of mind. This is known as mind blindness. And this is really the biggest one. The symptom of mind blindness is being susceptible to being manipulated and being victims of crime. So yes, these symptoms, I believe that those are the symptoms. Sensory overload, and then everything that comes with not being able to hear properly, and being victims of crime. This is what we need to be treating, and maybe use one of these more scientific methods to test for it. Just a thought.